student Christine Tan, and I'm a student nurse from Davao Doctors College. So today I'm going to perform a parenteral administration. So this is important because it can be used for drugs that are poorly absorbed and inactive or ineffective if given orally, and the four routes also provides immediate onset of actions. So first is check the doctor's order of the patient's chart. Then, prior to perform the procedure, introduce self and verify the client, identify using agency protocol, and explain the procedure to the client. So, hello ma'am. So, I'm gonna Christine Tan, your student nurse for today, and can I ask for your name?
Faith.
May I check your wristband to verify? Okay, Faith, Miss Faith Tan. Today I'm going to perform the intradermal. Then I'm going to inject you later the medication. And if may tanong po ba kayo?
No.
Okay, thank you po. Next is perform hand hygiene and observes appropriate infection prevention procedures. Then, next is arrange the medication on a hypodermic tray with the corresponding drugs. This is important to prevent the spread of microorganisms. Now I'm going to use the tuberculin syringe for the intradermal. And choose the medication of the patient and the ml. Okay. So remove the cup. Then then shake the bottle. Choose an injection site free of lesions and discolorations. Then select the site 3 to 4 finger widths below the antecubital space and 1 hand above the wrist. Position the patient's arm from his elbow and forearms and so that it is supported in a flat surface. Then apply clean gloves. Use an antiseptic swab to clean the site beginning to the center in circular motion outward about 2 inches into 5 centimeters. Remove the cup and hold the syringe between the thumb and forefinger of your dominant hand with the bevel of the needle pointing up. Then stretch the skin of the patient and then inject the site by pulling it gently with the thumb and forefinger of your dominant hand. Then pull the needle very closely to the patient's skin and insert it slowly 5 to 15 degrees angle until you feel the resistance. Then advance the needle up to the epidermis about 1/8 inches or 3 millimeters. Then slowly inject the medication to the patient. So after performing the intradermal, do not recap the used needle and put the syringe and needle into the receptacle and wash hands and document the procedure with the results, and then interpret the results after 30 minutes. Is I'm going to perform the subcutaneous injection. So check the doctor's order of the patient's chart. Then prior to perform the procedures, and introduce self to the client and verify client's identity. Then using agency protocol, then explain the procedure to the client and how or she can participate during the procedure. Hello, ma'am. I'm Dr. Christine Tan, and I'm a student nurse from Davao Doctors College. So, can I ask for your name, ma'am?
Faith.
Can I check your wristband to verify it? Okay, Miss Faith Tan. So, today I'm going to perform the subcutaneous injection. So, later on, I'm going to inject you some medications, and then if you have any concerns, you can ask a question. So, do you have any questions? Okay, thank you, Miss Faith. Permit tray and then the corresponding drug. This is important to prevent spread of microorganisms. Then I'm going to prepare the medication of my patient. Then I'm using the 1 ml syringe with a gauge of 25. Then gently shake the medication bottle. Then remove the cap. Then pull it from pressure. This is used for knowing how many ml of the patient will be used, how many millimeters. Next is determine which site you will use, and then shift patient's bed linen to expose only the potential injection site, then inspect the area for bruising and any inflammation and edema, then palpate the site and avoid any area that is tender. Then to make sure you have the right size needle, then use your thumb and forefinger to grasp, and then skinful of tissue and inject the site. Measure the fold from top to bottom and check to ensure that the needle is about half as long. The next is place the patient in a comfortable position and ask the patient to relax the area about to inject. Then apply clean gloves and clean the site with an antiseptic in a circular motion, then starting from the center to outward. And remove the needle of the cup by pulling it straight off. Hold the syringe between the thumb and forefinger of your dominant hand and as if holding a dart. Insert the needle quickly and firmly of 45 to 90 degrees angle. Release the pinch skin. Rest your non-dominant hand on the patient. Next is move your dominant hand at the end of the plunger. Then slowly inject the medication over several seconds. Then retain your grasp in the syringe to keep it still. Then quickly withdraw the needle. Place a swab or gauze pad on the site and apply gentle pressure but don't massage the area. Then apply a cotton ball soap with 70% in a circular. Then pinch the skin of the patient. And then inject the site. Injecting the patient, place the patient in a comfortable position and document the findings, and then record the time and amount of the drugs and medication sheet. So now I'm going to perform the intramuscular injection. So first is check the doctor's order and patient's chart. Then verify your client, then introduce yourself to the client and explain the procedure. So hello, I'm Christine Pen and I'm a student nurse from Davao Doctors College. So can I ask for your name, ma'am? So may I check your wristband to verify it? Okay, Miss Payton. So today I'm going to perform the intramuscular injection. So later on, I'm going to inject you later the medication that are needed. And I hope for your fully participation in this procedure. And if you have any questions, feel free to ask. So do you have any questions, Miss Faith?
No.
Okay, thank you for that. So next is select an appropriate location for the site of the injection. Then valgus lateralis and deltoid muscles are possible site for the intravascular injection. Then examine the integrity and amount of patient's muscle mass. Then palpate the muscle area of tenderness and not suitable for injection sites. Then next is inspect the area for bruising or any inflammations of the patient or any edema found, and then the skin shows any bruises or inflammation, use other site, and then help the patient find a comfortable position so that it will accommodate the injection, so that the patient will be comfortable during the injection process. Then expose only the position of the body, and then apply a clean gloves during the procedure. Then use anatomical landmarks to find the site again. Next is disinfect the injection site in a circular pattern from inner to outer for about 2 inches. Then hold the gauze pipe between the third and fourth fingers of your non-dominant hand. Then remove the needle cup and pulling it straight to the syringe and the thumb using forefinger of your dominant hand. You are holding a dart. Then place your ulnar side of your non-dominant just below at the injection site and pull it to the patient's skin laterally about 1 to 1/2 inches. Then position the client until you inserted the needle. So, Miss Faith, so can you okay. Dili ka soundlan. Apply a cotton balls with a 70%. Soak in a 70%. And pinch the skin of the patient. Inject it. Then place a cotton or a gauze pad. Then apply gently pressure but don't massage the area. Then place the patient in a comfortable position and document the findings of the procedure. Okay, so back. Okay. So it's already done. So thank you, Miss Faith, for your cooperation.